So what kind of a birth control are you using? I ask my patient. And oftentimes I get an answer, oh, I'm just using a natural family planning method. Well, there are a few different kinds of natural family planning methods out there. And I thought I would talk to you guys because we never sit down and discuss it in details at your GYN visit. Now, the natural family planning method depends on the fact that the egg, when it is released, is good for about 24 hours for fertilization. But the sperms can stay in the vagina up to 5 days. So fertilization can happen. So when you use a natural family planning method, then you are using that window, we call a fertility window, to either get pregnant if you're planning for a pregnancy or avoid pregnancy by just avoiding that period. It works the best when you have normal cycle. So what is a normal cycle? Normal cycle is a cycle which is between 26 to 32 days. If your cycles are shorter than 26 days or if your cycles are longer than 32 days, then the natural family planning may not work the best. Now, effectiveness of natural family planning method could be from 12%, or the failure rate, I should say, of the natural family planning could be from 12% to 23%. And why this big range there is just because it depends on whether you have a regular cycle, and number two, how motivated you are in using this method. It's not easy. It is not easy at all. It needs a lot of discipline. So there are a few different ways of using this method. So the number one is called a calendar method. So the calendar method depends on your menstrual cycle. So before you decide to use the calendar method, you need to track your menstrual cycle for at least 6 months. Yeah, at least 6 months before you actually start using it. So how do you track it? There are so many apps out there which will help you tracking your menstrual cycles, but you can also write it down. So what you write your first day of menstrual cycle. The first day of a cycle is a day when you have a full flow. Not brown spotting, not just a little bit, but actual full flow. So that's day one. Then you're going to count day 1, 2, 3, 4, and you're going to count till the next cycle start. So if your next cycle starts, say day 29, that means you had a 28-day cycle, right? So every month for 6 months, you're going to write it down, how long was your cycle. Then you're going to go back and see what was your longest cycle in that 6 months and what was your shortest cycle. Got it? So now from your longest cycle, you're going to take your longest cycle. I'm just going to give you an example that your longest cycle was 30 days, right? So from that longest cycle, you're going to subtract, you're going to take 11 out. So from 30, you're going to take 11. That means 19, right? That's the number you get, 19. So you're going to take your shortest cycle and you're going to subtract 18. So you're going to take 18 out from your shortest cycle. So for example, your shortest cycle was 28. You're going to take 18 out of it. So that gives you number 10. So from day 10, remember you started calculating day 1, which was your bleeding day, right? So day 10 to day 19, you should not have sex because that is your fertility window. I know it's a lot of mathematics and a lot of calculation. I know there are apps out there as well which will help you count it. But if you mess up on this, then you could get pregnant because you might be in that fertility window. So this is not a very popular method, but it's out there and I don't know if there are any people using it. So I just wanted to mention it. So this is called a calendar method. So the second method is called standard day method. This is commonly used and it again, it's good for people who have a normal cycle. That means the cycle between 26 to 32 days. So basically, if your cycle is from 26 to 32 days, all you have to do is to avoid sex from day 10 to day 19 every month. Every month, avoid sex around that time. It says effectiveness are about 85% as long as your cycles are regular and you are very, very motivated in using it. Now, don't have sex, or if you have sex, you have to use condoms or some kind of a protection to prevent pregnancy. So the third method is called cervical mucus test. Now, this method depends on the fact that your body makes cervical mucus, and the quantity and the quality of the cervical mucus changes as the menstrual cycle progresses. So you have to check your cervical mucus at least twice a day. Every day, twice a day. So when you do that, just take your 2 clean fingers and wipe it, or just look at your underwear or a pad you're wearing and take the cervical mucus and feel it between your fingers. What you are going to look for is the consistency and the elasticity of it. So the way this method works is that at the time of ovulation, your body produces a lot of cervical mucus. So the quantity is large and it's very slippery and it's very stretchy. So the days when it is slippery and stretchy and a lot, 3 days before and 2 days after is the time when you should not have sex. But this is in retrospect, so you're going to have to find out when this happens every month. Because by the time this happens, and if you were sexually active before, you miss that window. So it's kind of complicated because you have to be very dedicated in checking the cervical mucus every day, twice a day. Plus, there are times when your body may not produce enough amount of cervical mucus. You might be dehydrated, you might be on some medications, you might have a vaginal infection. Who knows what's going on? So the cervical mucus may not be a perfect method, but some people like it and they use it. So I thought, hey, why not mention it? And the next method, which is a little bit more popular and a little bit easier to use, is called a basal body temperature method. So the temperature, our body temperature changes all the time. It's not a constant thing, right? And at the time of ovulation, there's a little bit of a temperature spike. It goes up by 0.5 to 1 degree. It's not huge, it's slight, but it's there. So by checking your temperature every single day, you're going to find out where your baseline temperature is. And you will see that little spike at the time of ovulation. Now, when I say check your temperature, the temperature should be checked first thing in the morning before you get up, before you do anything, before you will check your phone, do anything. Check your temperature. And you need to have at least 3 hours of restful sleep before you check that temperature, because the temperature is such a flexible thing, it keeps changing. So make sure you have good sleep. You check it first thing in the morning, write it down somewhere, and then you can put it on a graph. And keep doing it every single day. Once you see the spike, few days before the spike and 2 days after the spike is the fertility window. So again, this is more helpful in retrospect. You're going to need to check your temperature for a few months ahead and know when the temperature spike is happening in your cycle to avoid. This is also very useful when people are trying to get pregnant, because that's when they will have, they should have sex to get pregnant. So basal body temperature, it's kind of needs a lot of your dedication. Obviously, you have to take it every day. You need a special kind of a thermometer. You cannot just use any thermometer because the changes are so small that you have to use something called a basal body temperature thermometer. You can find a lot of those graphs. I think Planned Parenthood had the app which has those apps, or there are so many out there which will have a graph, and you can just put the temperature on it and it will give you that graph and tell you when the ovulation is happening. So a popular method, a lot of people use it, a little bit easier than a cervical mucus, I should say. But guess what? There is a method called a symptothermal method. That means it combines two things. It combines basal body temperature chart as well as cervical mucus together and predict the ovulation time and predict your fertility window. So you could combine those two methods and use it for prevention of pregnancy or to get pregnant, either or. Last but not least, there is another method called a market method where you're gonna actually use a small electronic monitor which will help predicting the hormone surge. There is a hormone called LH, or a luteinizing hormone. There's a surge of that hormone happens right before ovulation. And also the estrogen and the progesterone level changes during ovulation. And these monitors help you find which is the best time to avoid pregnancy. So natural family planning, it seems very simple, but it can be a little complicated. It will take a lot of dedication from you and your partner to be successful in using this method. You can use it. It's cheap. You don't need really anything but maybe a thermometer at the most, and a piece of paper and a pencil, right? Or a free app on your phone. But dedication is the key. The advantages of that, you get more in tune with your body. You would know what changes are happening in your body when the ovulation is happening. And when you're trying for pregnancy, it helps you know when the ovulation is happening and time the intercourse. So there are advantages and disadvantages out there. If this is something you are interested in, you want more information, please leave me comments below or contact me on any of my social media sites.